And I'm going to hand over now to Jennifer Baker, who will take us through a short interview prior to the all-important coffee session. Jennifer, over to you.
Thank you very much. Is this working? Can you hear me? Yes, wonderful. Thank you very much. I'm sure you've all been energised by those informative keynote speeches. Now we're going to go to a one-on-one interview, and this is going to get to the heart of the policy making in the EU, because joining us we are very pleased to have John Ryan, who is Director for the Public Health Unit in DG Sante in the European Commission. John, thank you, and please give him a warm welcome. You're going to have to hear. Okay, so we've called this session the EU's contribution to the health of citizens, achievements, lessons and pending issues. But let's jump straight in with the big issue, which is we've got a new commission. So what are going to be the key public health priorities for the next 5 years? I know that's a big question, but give us the highlights.
So, good morning, everybody. First of all. Secondly, what you said is partially correct. We have a nomination for a new commission.
This is true.
Unfortunately, it's not going entirely as planned, and we still have some finalisation of the incoming team by the European Parliament, because each commissioner is heard individually in the European Parliament and is subjected to a number of questions on their policy area. And until that process is finished, the new commission won't come into place. So we're still uncertain about that. But just to explain that the new commission president designate has already given her political guidelines and sent what we call mission letters to each individual commissioner, setting out where she thinks they should focus in the next 5 years. And the Commissioner Designate for Health is a lady from Cyprus who has been asked to work specifically on developing a cancer action plan at the European Union level as one of her main deliverables. It's also something which is mentioned in the political guidelines of the President. So both of them have committed to doing this. There's also a reference in her mission letter, in her agenda for the next 5 years, to the topic of vaccination, which is something which the current Commission has been working on for the last number of years, but more intensively this year and last, I would say. And also, of course, the third topic, in addition to cancer and vaccination, third topic, which really has a prevention aspect, is the topic of antimicrobial resistance. And I chaired yesterday a meeting of the veterinary authorities and the public health authorities from our member states, and I can tell you that we are far from having dealt with this particular issue, which is like a train coming down the line towards us. We know it's coming and we know it's going to cause a lot of damage, but the measures to contain antimicrobial resistance have not been completely implemented either in the European Union member states, but also internationally, which is even more of a challenge. So those three topics have been mentioned as priorities for the incoming health commissioner. That does not mean, of course, that everything else that we're doing is forgotten, because the general framework for all of our action on public health is a process called the Sustainable Development Goals, which are targets which have been agreed internationally by the United Nations. Now, the interesting thing about this is there's a specific target on health, including strong references to chronic diseases, but there are also other targets which are related to health. In other words, things like gender equality and poverty and so on. Education. So it's a whole of society approach that the United Nations has taken. Two interesting points about that, I think, just to draw to your attention. First of all, the Sustainable Development Goals have been signed up to by all of our member states and by the European Commission. So in other words, when we're making proposals for legislation, when we are adopting legislative text, strategies and so on, all of these are supposed to take the Sustainable Development Goals into account, and this is analysed and followed centrally by the Commission. The Member States are also doing the same, so it's a very good framework, in fact, for ensuring that health is a component in all policies. And that brings me to my last, perhaps, point on this subject, which is that health is not only the business of the Health Commissioner. In fact, health is very often the business of everybody else and the Health Commissioner. It should be. So in other words, if we're reviewing the legislation on taxation on alcohol, for instance, or on sugar drinks, just to take those two examples, then obviously there's a very strong health component. If we're developing a policy on social welfare, on helping the unemployed to reintegrate the workforce, that obviously has a very strong health component as well. If we're talking about the common agricultural policy, because people eat and drink food which is subsidized by the European Union, then that also has a strong health component. So what I'm saying to you is vaccination, antimicrobial resistance, cancer are things which are specifically mentioned. The rest of the work will continue as before. These are just focus areas, all within the framework of the Sustainable Development Goals. And health is really part of all of our policies at the Community Union, the European Community level.
I mean, those three big points are probably not a surprise. I mean, cancer is always mentioned. I mean, there's been a lot of media attention, of course, around vaccination and microbial resistance. But, you know, when we're talking about RMDs, you know, they affect more than 120 million people. The burden is estimated to be around, 240 million euros a year. That doesn't really make the headlines. I mean, how does the European Commission put these chronic problems front and centre, rather than, as I say, the kind of the splashy media headlines?
The first point I make is I think it is useful to have some economic indicators when you're discussing health, because very often people don't realise the impact that poor health has on the economic well-being of our society. However, that doesn't mean that we're putting a price tag on individual diseases, because if you go down that particular road, then I think it's very dangerous territory. It doesn't exclude the fact, as I say, that you try and estimate what the cost of what you're proposing is, or what the cost of non-action is. I think that's often a very good equation. So, for example, we have been financing a lot of studies with the OECD over the last number of years. And I'd mention in particular two reports which have been published by the OECD at our request. One dealing with childhood obesity. And here you can clearly see the costs for society over a lifetime have been calculated by the OECD of childhood obesity, and therefore they have tried to identify as well certain interventions which would be cost effective from the societal point of view in order to reduce those long-term costs, either in terms of employability, poor educational outcomes, but also, of course, poor health outcomes. So this is something we've been trying to use the economic figures and merge them with the health statistics in order to come up with compelling arguments. The same approach I would suggest has been taken by the OECD in a report on antimicrobial resistance, where they have also identified where the burden of antimicrobial resistance occurs in the health system. And you won't be surprised, of course, to hear that this is mostly in the hospital system, and it's linked to patient safety issues as well. And they've also tried to identify cost-effective and evaluated interventions which can reduce the burden of antimicrobial resistance. So these are examples of where we've tried to mobilize economic data to put forward strong arguments in favor of prevention. You may not be aware of the figures from the OECD again, that 97% of our healthcare budgets are spent on average in Europe on care and on treatment, and 3% on prevention. So with this misbalance between preventing diseases and then having to pay 90%, 97% on actually curing or treating diseases, this is unsustainable in the long term.
Okay, that's sort of talking, you know, to the wider public, I guess. Is there a need? I mean, how does that work within the Commission? How do the DGs work in different ways? I mean, DG Santé, we know, you know, that you go to the different DGs and they've all got their own agendas. They've all got their own outcomes that they want to see. Do they work together? Do you fight with each other?
Well, even if we fought with each other, I wouldn't tell you that we fight with each other. But no, it's generally fairly civilized. It's also civilized by the fact that we often transfer between departments. So you could be fighting your future colleagues or your future boss. So that I would say the system we have in the Commission is very similar to the one you have at national level. In other words, you have national departments, but you also have a cabinet office, or you have a secretary general who makes sure the whole system works smoothly. And we have the same thing. We have a very strong secretary general and a strong secretary general's office, and they make sure that the silo approach is not allowed. So each department who makes a proposal on a particular subject, whether it's industrial policy or a new agenda for migration, for instance, has to bring in all the departments of the Commission who might be concerned. And those arguments are written down, they're documented, and each commissioner then has the possibility at his level or her level to remake those arguments if the colleagues in the departments couldn't convince the other departments of the validity of their arguments. That can be raised to the political level. So in principle, decisions which are taken, proposals which are made, are done so on a collegial basis. In other words, that all of the departments have to sign up and agree that those proposals are reflecting the overall point of view of the Commission.
Well, let me ask in particular about a couple of the silo areas that, you know, we think probably should be brought more closely into health, which are innovation and employment. That we, you know, how do you reach out to those particular areas?
Well, a good example is the employment area, where, of course, this is one of the goals of the Sustainable Development process. And we work very closely with our colleagues in employment, particularly in the context of the Social Protection Committee. Social Protection Committee is a committee established of trade unions, member states and the Commission, which looks on a regular basis at how employment conditions can be improved. And then this leads very often to either financial investments or to investments in terms of legislation and changes and strengthening of legislation, for example, in the area of worker protection. So DG Santé also has a very strong role there to play in terms of protecting the interests of the public health community, but also pointing out perhaps the health system requirements.
Let's talk about money.
Money, yes.
Yes. So, what are the key considerations when investing in public health? What, you know, where is the European Commission's pot of gold in all of this going?
There are several pots of gold, I would say.
Good.
So we're talking at the moment about, I won't talk so much about the present situation, but rather the future. So the future Commission, which is coming into place towards the end of the year, probably in November, December, will have a time frame of 5 years. But the budget, which we're in the process of adopting, has a time frame of 7 years, so 2 years in addition. And there, we're in the final stages at the moment of negotiating the future budget and the future financial programs. And there are two programs which I'd mention in particular. First is the health program, which will be part of the European Social Fund in the future. and which will have an annual budget of about 65 million euros. We use this to fund, for example, activities of the European reference networks, which specialise on rare disease treatment and management. But also the cancer registries, for example, are financed through the health programme. Now, there's a second programme which I'd like to mention to you, which is substantially more important from a financial point of view. It has an annual budget of 1.5 billion euros. And this is the European Research Programme, the Horizon Europe programme. So for the health research, there will be a budget of 1.5 billion euros per year, compared to 65 million for the health programme. And what we're trying to do at the moment is to develop a long-term strategic programme for research in health. A programme has been drafted, it's been discussed with the member states, it's been discussed with stakeholders like yourselves at the Research and Innovation Days, which took place here in Brussels 2 weeks ago. It's still open for consultation on the website, so it's not finalised. And we're in the process at the moment of developing the implementation, the work plans for the first year of the programme. Those are two examples of where we're directly investing in health, but we also have the Structural Reform Service, which has its own pot of money. And I heard yesterday from colleagues in Latvia that they had actually successfully applied for financing for their antimicrobial resistance action plan in Latvia through this reform service. So there are lots of different pockets of money around the community budget. One which you may not have thought of or may not have imagined is in the Common Agricultural Policy, which actually funds the delivery of fruit, vegetables and milk to our school kids around Europe. So that's not very often known about, but it contributes to improving nutrition and providing access to fruit and veg in our school settings around Europe, and that's paid for from the Common Agricultural Policy. So there's lots of pockets of money like that around, but I'd say the principal one is probably the research programme, the European Social Fund and the health programme.
So building on from that, obviously we want these investments to be effective to sort of strengthen the actual impact of health policy. Does the Commission have a role in sort of assessing, how do you monitor that, the effectiveness?
So I think the first step in effectiveness is involving the right people at the right time. And the Commission has made a move last year to more closely involve the Member States in fixing the priorities. So instead of the Commission trying to imagine what the needs of the Member States are, we're actually asking them directly to identify where they would like us to invest. Now, we have a process for doing this. We have a group of Member State health ministries which help us to identify on a yearly basis where they would like us to put the focus. This year, for instance, the area of mental health is one where the Member States have asked us to identify interventions and to finance those interventions. Last year we invested, for example, in colorectal cancer screening and cardiovascular screening. And there the Member States again took up some interventions and we paid for them.
Okay, well, final question then before we keep people from their coffee. The EU, the European Union, the European Commission can sometimes seem a little bit remote. You know, it's not your local authority or your hospital or even your own government. So how can European health policy give a central role to citizens and patients, you know, when there is that big divide?
So we don't replace the Member States in any way. We try and coordinate the position of Member States to make health policy more effective. A good example I could give you is on the area of communicable diseases, where clearly each Member State has its own responsibility for controlling communicable diseases. But since these diseases cross the frontier, it's very important that we have common systems in place to monitor and survey and to respond if there are cross-border transfers of communicable diseases. But what we do find very important is as well to have a dialogue with citizens and also with health professionals and with NGOs, civil society. And I would mention in particular an initiative which we took last year, which is the establishment of a health policy forum. So we decided that having meetings such as you're having in this room today were not an effective, I'm sorry to say, not an effective way of communicating with stakeholders, because you're listening to me, but I'm not listening to you. So we thought that this was also limiting. It was a limiting factor because people had to be able to travel to the same place at the same time and be in the same room. And it was very frustrating, in fact, for us to organise meetings and not to see this dialogue moving forward. So we created a platform basically called the Health Policy Platform, which allows anybody who's interested in health, but particularly professionals and NGO groups, to dialogue with each other and with the Commission on specific topics. So a little bit like chat rooms, if you like, where you have a chat room on nutrition, another one on measles, another one on obesity, and the experts together can determine positions which are then passed to the Commission, and the Commission can then work with those. So instead of having, if you like, 20 or 30 different individual positions, this is a process where the NGOs together and the professional organisations can come up with common positions to discuss with the Commission.
Okay, thank you very much. We're going to stop now.